It's absolutely hellish, actually. I've never lived through anything like this. Every day brings news of a loved one or a much loved one who is either in hospital or worse, or dying or dead. The stories are just too many to take, and it's the same for everybody that I know. And everyone that I know is also either infected or getting out of an infection. The scale of it is just unimaginable, and I've never lived through anything like this, and I hope I never do again. All hospitals, I think, everywhere in India are under heavy pressure. I think they're under greater pressure in places like Delhi, where the need seems to be much greater and the spread of infections has been, I think, more severe. But one of the aspects of this tragedy is just how many deaths were preventable. If we assume that the surge in the coronavirus cases wasn't preventable, which is also not entirely true because there were relaxations and I think an irresponsible encouragement of large gatherings that contributed to the surge, certainly. But the fact is that even with the number of cases that we have, the mortality rate in India is entirely induced by the failure of the Indian health system to treat people. So the people who are dying aren't actually dying of COVID in the sense that they wouldn't be dying if we were in Sweden. They're dying because the hospital infrastructure and the public health system actually doesn't have space for them. We don't have enough oxygen for them, and the entire health system is just buckling under the pressure of the demand. And so people are dying from a lack of basic care, which is really sad.